Hello, everyone. It's Labor Day, September the 6th. Very regretfully, I wanted to come in today from the standpoint of, I just felt like, if we don't come in today, we came in Friday, we don't come in till the next following Wednesday, and it's just too far, too much going on. And to be perfectly honest, I know we're going to continue to have people that are going to die. And say what you want, but I don't want to come in here, 4 or 5 days from when the last time I was here and read all the deaths. It's bad enough the way it is. We've lost 24 additional people since Friday. I'll ask for your prayers again, but I'll ask more than anything for you to get yourself vaccinated to stop this. This is, I don't know that we could say it's completely preventable, but it surely could absolutely cut down these numbers in a big way. The 3,125th death in West Virginia is a 54-year-old male from Lewis County. The 3,126th death is a 50-year-old male from Roane County. The 3,127th death is an 80-year-old female from Brooke County. The 3,128th death is a 93-year-old female from Braxton County. The 3,129th death is a 61-year-old male from Mason County. The 3,130th death is a 102-year-old female from Doddridge County. Bless her heart. And thank you for all the wisdom that she gave us. The 3,131st death is a 46-year-old female from Marshall County. And I hate this so badly because this is an awful young lady. What a life she had in front of her, and it's really sad, really sad. The 3,132nd death is a 93-year-old female from Raleigh County. The 3,133rd death, an 86-year-old female from Braxton County. The 3,134th death, a 92-year-old female from Marshall County. The 3,135th death, a 70-year-old female from Marshall County. The 3,136th death is a 63-year-old female from Kanawha County. The 3,137th death is a 71-year-old male from Wayne County. The 3,138th death is a 79-year-old female from Ohio County. The 3,139th death is a 64-year-old female from Kanawha County. The 3,140th death is an 81-year-old male from Lewis County. The 3,141st death, an 80-year-old male from Wyoming County. The 3,142nd death, a 72-year-old male from Harrison County. The 3,143rd death is a 76-year-old female from Hancock County. The 3,144th death is a 47-year-old male from Wyoming County. The 3,145th death is a 72-year-old female from Jefferson County. The 3,146th death is a 71-year-old female from Pendleton County. The 3,147th death is a 60-year-old male from Jefferson County. And the 3,148th death in West Virginia is a 78-year-old male from Raleigh County. I don't know when in the world we're going to just completely, everyone realize, rights or no rights or whatever it may be, absolutely that you need to really get vaccinated. You need to give to your neighbors, and you need to absolutely extend that love. And I know you're loving, caring, great people. I get that. I know that. But we've got to some way realize that we've got to get vaccinated for all, not just for you, but for everybody. We've got to do this. We can stop a lot of this terrible, terrible, terrible carnage. With 1,316 new cases in the last 24 hours, our daily positivity rate is at 10.73. We continue to climb like crazy on this cumulative rate at 5.33. Get this right here. We have active cases in West Virginia right now of 21,500 active cases. How many of them are going to die? How many of them are going to die? Probably a bunch of them, to tell you the truth. We have 709 hospitalized patients in West Virginia, 216 in the ICU units, an all-time record high, again, 112 on ventilators. Our map, for all practical purposes, looks solid red now. There's a few counties, a couple that are gold and a few that are orange, but really and truly, we've got a really big time situation in West Virginia, as is all across this nation. We have currently 59 outbreaks in our schools in 26 counties. 19 schools are closed due to COVID. 30 counties have declared the mask mandate. I remind everybody over and over, if you're 65 and older, you really need to go get a test if you're having any symptoms at all. The antibodies would probably very well save your life. I want to recognize Labor Day right now. I really appreciate all my staff, coming in today so we could do our briefing. I just felt like that we needed to be here. But, let's just take time over this wonderful holiday to recognize just what has been in place since in the 19th century. We've recognized our labor. We've recognized the labor that has given us strength and built our nation. With all that being said, should we not now recognize the labor of all those that ran to the fire to protect us through all this terrible pandemic? Whether they were first responders or health departments or the hospitals or even the grocery workers that absolutely stayed open, knowing that every day when they climbed out of bed, strapped on their boots, that they were going right into the fire. Absolutely for all of us. So we pray that everybody will recognize and appreciate the significance of labor and what an incredible holiday this is. So God bless you all and thank you in every way. From Kathy, from myself, from all of us. Again, I told you over and over the percentage of those that are in the hospitals that have not been vaccinated is very, very high. I encourage you to wear a face covering if you're in a crowd, especially if you're 65 and older and everything, but it can only do one thing, and that is protect you even better. From the standpoint of mandates, I think our local control on masking has been the best decision. We're letting people on the local level where they know it and they know it the very best make those decisions and make those decisions in a great way. From the standpoint of, and things that I surely don't understand is, many of us have advocated all along that we want the people to make decisions. We want the local levels to make more decisions and everything. That's what it should all be about. Charleston has a proven track record, of not being able to get it exactly right. Now, I'll promise you that from the standpoint of our health officials and everything, that the decisions that we've made for your benefit and everything, I'm very, very proud of. But at the same time, we want the locals to make as many decisions as we can see that they can make and make in a great way, and they're doing exactly that. Okay, from the standpoint of Pfizer, it's fully approved by the FDA. If we could just get the go-ahead from our government to absolutely start administering these booster shots, we would be all over that, and we would be doing that immediately. We're ready to go. the general, his entire group, the health agencies all across the state, so many different aspects of this, from pharmacy to right on down, and we're ready. We're ready, but we just can't get the go-ahead. We're continuing to try. We're going to continue to try, but we just can't get them across the finish line. West Virginia, over and over, I've told you we've led the nation. We have led the nation and everything, but right now, the nation is holding us up from being able to continue to lead. We've got people that are well beyond 6 months, that are 60 and older, that need the booster shot. And we can't give it to them because we're being held up by, the nation and on the federal level right now. We did our first round of Do It for Baby Dog. It's really Do It for Baby Dog round 2, but we did our first giveaways, last week and on Thursday, and they were really great. I go back to really, I love it when we're able to give scholarships to our kids, because we're really trying to motivate our kids to get them vaccinated, no question, but really and truly, it's a special, special day when we're able to give something to a child that is so impactful as a scholarship to get a college education. And oh, gracious, was it ever so in view at George Washington High School. But at Princeton Middle School, it was unbelievable. It was totally unbelievable. I salute the superintendent, the assistant superintendent, the principal, all those that made that happen over there for a family that was probably having a tough way to go. Absolutely, it was just plain great. It was a reflection of what West Virginians are all about, and about a peoples that give and a people that love, and it was really, really, really good. So we're going to continue that. We'll be out next Thursday again, or this coming Thursday, and if you haven't registered, you're missing out on something, but more than anything, we got to get you vaccinated. The vaccine eligibility is 12 and above. The natural immunities are great and everything, and I guess it's a very controversial topic right now, but really and truly from the medical community, I'm told over and over that they're not good enough. You need to get vaccinated. Our young people, especially those from 12 to probably 25, we've got to get a way higher percentage of you vaccinated than you are right now. All of our COVID information's up on our website. I remind you over and over about getting tested, and I thank Frith and I thank Walgreens for all their great work. We have 58 outbreaks in our long-term care facilities, 4 outbreaks in our church communities. That's Barber, Doddridge, Monroe, and Wayne counties. We have 88 inmates now that are stricken with COVID, and 57 staff members. Over and over, I tell you about giving blood. We've got a thing going on for our grand families to where, as they get their kids, the kids that they have, vaccinated and everything, they're going to receive a $150 school voucher, and registration will begin tomorrow for this, September the 7th. So grand families, come on, get the kids that are with you vaccinated, and please, please, please register to where we can start getting you that $150, because we want to do that really bad, because that's just going to make things a little bit easier for the kids and a little bit easier for you. But more than anything, we thank you. We thank you for being something really special. 19,000 kids in this state, grand families taking care of them. So from the standpoint of those grandparents stepping up, thank you so much in every way. Last thing I've got is got to do something really special. I'd promised these people that I'd come. Then we ended up with a conflict on Saturday, and it was really, really tough to get there and everything. But we went anyway, and we made it all happen and everything. And that's Bluefield State College has not played football for 41 years. And Bluefield State College is a success story beyond belief. Senator Bill Cole's been really involved, but so many over there have done, well, there he is, there have done great, great, great work. And, you know, that's our president right there, Robin and Bill and myself. And I can tell you that Bluefield State is on the move. That's all there is to it. I was able to do the coin toss, and it just so happened Bluefield State won the coin toss. That was good and everything. We ended up getting beaten the game by Lawrence Tech 21-14, but a great game, a great battle, and there's two young men that are on the Bluefield State's team, and it's just a good day, and really proud of that school, and really proud of their contribution not only to West Virginia, but especially to Southern West Virginia. So, Coach, I know you had a tough loss right there, but a good start, and just keep it up. Keep up the great work. Nevertheless, that's all I've got.
Thank you, Governor. Let's now go to Retired Major General Jim Hoyer, Director of our Joint Interagency Task Force.
Good morning. As with the Governor, I'd like to thank all of our workers on Labor Day, particularly our frontline workers during this pandemic, healthcare, retail and logistics, manufacturing and food and agriculture workers, as well as our team from DHHR, local health departments, EMS, and the National Guard, all who have allowed us to continue to move on during this pandemic and continue to fight to weather the challenging storm that we have. Just to reinforce a couple of points the Governor's made related to the significance of vaccinations. Still over 82% of the people in the hospitals in West Virginia are unvaccinated. As the Governor pointed out, 216 in the ICUs exceeds our peak number during the last surge, as well as 112 exceeds our peak on ventilators during the last surge. We're working closely at the Governor's direction with the Hospital Association, also the Long-Term Care Association folks, as well as EMS, to make sure that we can meet the challenges going forward. We're starting to see additional challenges in our critical access hospitals. And as the Governor pointed out, 24 additional deaths. My concern for West Virginia is, with flu season coming on in the fall and winter, unvaccinated West Virginians are going to have a challenging fall and winter, and going to cause West Virginia to have a challenging fall and winter. So again, I would ask everyone to please, as the Governor pointed out, take on the responsibility for others in your community. Go out and get vaccinated. Thank you.
Thank you, sir. Dr. Ayn Amjad, our State Health Officer, and Secretary Bill Crouch with the DHHR are also joining us today and are available for questions. Dr. Clay Marsh, our coronavirus czar, had a prior engagement and will rejoin us on Wednesday. We'll now go to questions from members of the media. Our first question today is from Mark Curtis with Nexstar Media.
Governor, good morning, everyone else, and happy Labor Day. I'd like the Governor and perhaps Dr. Amjad to weigh in on my question. My phone is ringing off the hook. My email, my text is just blowing up with people from Putnam County that are really upset that there is no mask mandate in the schools, and they're having really an incident out there. For example, this morning I got word that George Washington Elementary School is on complete quarantine for the next week because they have so many positive cases. I don't know the exact number, but it's enough to basically shut the school down for a week. I also got a call from a parent, and this circles back to my question last week about the vulnerability of middle schools, because the 12 and 13-year-olds can get vaccinated, the 11-year-olds in middle schools cannot, and so they're perhaps the most vulnerable school population. Here's the scenario this parent painted for me. Has a child in middle school, was fully vaccinated. The child came home not feeling well, got tested for COVID, and tested positive, obviously a breakthrough case. In the same household, and there's no way to directly say whether this child transmitted it to a 3-year-old sibling, a 3-year-old. The mom says maybe the baby got it elsewhere, but now we have a 3-year-old in that same family tested positive for COVID-19. I know you want to leave it up to the local level, Governor, but obviously the school board had the choice in Putnam County to mandate masks K through 12 or maybe just K through middle school, and they chose not to. I mean, at what point are you going to step in when we have just an outbreak like this in one of our counties, and the people there seemingly at the local level can't make what many deem the right decision and have everybody masked up? When will you step in? And Dr. Amjad, what's your advice in a situation like this, especially as I pointed out, middle schools are the most vulnerable because some kids can get vaccinated, others can't. Should they be wearing masks or should it still be optional?
Well, Mark, let me take the question first, and we'll defer to Dr. Amjad. But Mark, we have a difficult situation, do we not? I mean, really, when it really boils right down to it, I have tried so hard to leave it to the local level in thinking the local people will make the right decision. You know, you've got a vote. I think a vote of the board there was 5-0. 5-0, you know, no mask. You know, to me, it doesn't make a lot of sense a lot of times. And I try with all in me to be respectful of everyone around. You know, Mark, you're right in that it is a very, very, very difficult decision on exactly what to do. You know, from a standpoint of the parents are still making decisions about their own kids and everything. And Mark, our folks are looking at this nonstop. Now, does that give you the answer that you want? Well, of course, it doesn't give you the answer that you want, but absolutely, without any question whatsoever, it is a situation that is silly. It's silly, you know, when you really step right back and think about it. I have never got in the world what a hot button, a mask could possibly be. I have never gotten in any way the fact that how in the world we could stop and not get ourselves completely vaccinated in this state. I don't get it. I really don't get it. You know, I am trying to abide by the wishes of the local people and everything in making the very best decision for their counties, especially from the standpoint of their schools. I mean, you've got boards of education, you've got superintendents, you've got people in the school system that ought to be making these decisions on a local level. You know, I would tell the people of Putnam County, really and truly, that if they do not agree with what's going on there, they shouldn't elect these people as school board members. They should not go to the polls and just elect them and rubber stamp these people. But absolutely, I absolutely want to abide by the fact that local people should be making the very best decisions for their county. And really and truly, you know, I can't deny that it is a bad decision. You know, I mean, or a good decision, either one. But nevertheless, I'm going to try with all in me to hang on here and let the locals make those decisions. But Mark, you know, if the parents, if the people of Putnam County do not believe in this decision and everything, then they should be expressing those views to the local boards. I've given them so many options, you know, from the standpoint, you know, if your kid wants to go to school in Putnam County and you want them to wear a mask, have them wear their mask. You know, from the standpoint of mandating in the schools, that decision has to be right now for the local level. But that can change, and we're looking at it, Mark. We're looking at it nonstop. You know, It's a very, 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 very fine line and very difficult line to figure out, to tell you the truth. But nevertheless, Dr. Amjad, maybe you can take the rest of that question, please.
Yes, Governor. And Mark, I mean, that it goes along with what the governor is saying. You know, we do believe children should be wearing masks indoors. Adults are wearing masks indoors right now at this time. We also believe that everyone should get vaccinated in West Virginia if you're of age. But going along with those lines too, it is a decision at the local level and also at a parent level too. So everything that the governor just said, we can't disagree with that. But children at that age indoors should be wearing masks. We left it to the local school decisions. We also left testing to the local decision as well. So, all these things are mitigation efforts that are layered approaches. We have vaccines that are out there. People are still not getting vaccinated. So these are things that we've left to people to decide. But, for your basic question, yes, people should be wearing masks indoors, and people are still not doing it or they're not getting vaccinated. So those are people's choices right now. Thanks.
Thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel and fellow journalists, and happy Labor Day. Governor, I know you begin every briefing with a reading of the list of those who have passed away in the Mountain State, and we listen to that. But there's another level of COVID-19 that I don't think has gotten enough attention, and that is the people that get sick and then have to recover. On our staff, we have one in the hospital on a ventilator. We have two others that had breakthrough cases here in the last couple of weeks, so we have a small staff. If you get sick enough to be hospitalized by COVID-19, I don't think it's when you get out of the hospital, you're done recovering. I'd like to get a read from Dr. Amjad and maybe Secretary Crouch too about what families go through when they have a family member that contracts COVID-19, goes to the hospital, and then has to recover. Thank you.
Well, Paul, I'll pass to them in just a second, but I can't be more vivid. I'll promise you what the people go through and the families go through is absolute hell. That's all there is to it. I don't know how in the world and what on this earth we are continuing to do to continue to plead with people to get vaccinated. I mean, you're talking about lying there, maybe you can't even see your loved ones, and gasping for breath, just gasping for breath over and over. And then the side effects, can be long-term and can be a real issue. The economic impact can be unbelievable for your family. Absolutely, there's so many different things. Paul, I don't get it. I just don't get it. Dr. Amjad, maybe you can answer better than I.
Yes. So, Paul, we do know there are some symptoms called long COVID that people are experiencing, and there's still some more research or studies going into it. So you might have heard people who have COVID, they complain of brain fog, fatigue, kind of similar to some fibromyalgia type symptoms. So that's just a physical or mental aspect that people are complaining of. And then, of course, there's the social aspect of it, people missing their jobs, maybe there's some monetary loss. So those are some of the aspects of it. And then, of course, there's the loss of your family members and what the governor is referring that you don't get to say goodbye to them because you don't get to visit them in the hospital. Then you don't also get to have the funeral arrangements that you normally would have. So all those things that you get to grieve and you get to see your family member, we don't get to share those things. So I think, having someone die from COVID, you don't get to experience the normal loss or grieving process. And then the people who do survive COVID, there's probably a lot of depression, a lot of agony that goes along with that because you're in the hospital alone. So, COVID is going to have a long lasting effect. We also don't know what children are going to go through. So, there's a lot of unknowns to it. And I think a lot of maybe healthcare providers are suffering as well, mentally dealing with that from exhaustion, along with our frontline workers. So COVID is going to have a long-lasting effect, I think, for the years to come with all those different aspects that I mentioned. I don't know if the secretary has anything to add, because we're also dealing with that with a lot of our other, staff and things like that from missing work. But.
Yeah, thank you, Dr. Amjad. The governor and Dr. Amjad covered that very well. The isolation and the loneliness for families who are experiencing this virus, experiencing this disease, and have death and illness in their families without the support systems that they normally have is difficult at best. We worry about long COVID. The governor has talked about folks who talk about getting COVID and thinking they're protected. Well, just because you've had COVID once does not mean you cannot have COVID again. We have several, many examples of that in our state alone. So it's a concern, but long COVID is something we still don't know enough about. We haven't studied it enough yet. And the real concern, one of the real concerns I have is long COVID in children, the potential for children who end up with this virus being sick. And even if it's a mild case, there's some indication that there are symptoms down the road and causes down the road of illness, other illnesses that are related. So we don't know enough about this right now, but we're concerned. But Paul, it was a great question. Thank you for that.
Thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. So I have a couple of questions for General Hoyer. Last week, sir, you mentioned that some of our hospitals and some of the places in our healthcare network had expressed concerns about supply shortages in other states, particularly shortages of oxygen. Are we starting to see those impacts, or could you give us an update on that? And then today you mentioned that we were starting to see additional challenges at some of our critical access hospitals. Could you elaborate on what those challenges are? Thank you.
General, please.
Yes, sir, Governor. So Charles, yes, as pointed out just a few minutes ago, 216 in ICU. That's our highest number, higher than the last surge. 112 on ventilators. As you may have seen in press accounts this weekend, particularly in the southern part of the state, I know Raleigh General, ARH, Princeton, all had put out press releases, referenced their concerns about approaching capacity. So we continue to see that. We work daily with the hospital association and all the facilities. So far, we continue to manage okay right now. Oxygen, there's a lot of additional efforts going on, and Dr. Amjad and her team are working on some additional mobile capabilities for the antibody treatment. All those are designed to continue to take pressure off of our hospitals. Right now, we are managing, but we see significant challenges ahead. Particularly as was pointed out in press releases by those three southern facilities. We do not have hospital update numbers today or vaccine numbers because those come from outside sources and they are not updating today on Labor Day, but we will have those numbers again tomorrow and on the press brief on Wednesday. Thank you.
Thank you, Charles. Next, we'll go to Brendan Tierney with WSAZ.
AZ News Channel 3 here. My question's for the governor as well as Dr. Amjad, because in the past we have seen after holidays, we saw it with Thanksgiving, then Christmas, then Memorial Day, those cases increase. And we're already sitting at over 21,000 COVID-19 cases in West Virginia right now. So what do we realistically expect to see in the coming days with positive tests coming out of spread of the virus today and over this weekend? And might those push hospitals to the limits past where we're seeing already? And then what should people be doing this weekend to try to mitigate that? If it's avoiding their barbecues, or their cookouts, or different things like that to try to prevent the spread. Thank you.
Let me start off by saying this, and I hope to goodness that we got still a bunch of people that are watching and everything. And I just tell you this: one of two things is going to happen for absolute certain. Either we're going to reach a peak, and the good part about the Delta variant from what we've seen over and over is you reach a peak and then it really starts to fall off and you really back down. One of two things is going to happen. We're going to reach the peak and it's going to start down relatively soon, or what is more apt to happen is just this. It's going to get colder. And as it gets colder, we're going to be more in confined areas, and it's going to get worse. Right now, we've got 21,000 cases, 21,500 active cases. A bunch of those people are going to die. Without any question whatsoever, we're going to have a whole lot more people die. The colder it gets, the more apt that it's going to be a bigger problem than it is today. Now, what should people be doing? You know, as far as having their picnic or whatever like that, I'm all for them having their picnic, but what they should do, before they go to the picnic, they need to go get themselves vaccinated. I've said it over and over, Brendan, that there is nothing that they're doing in their life today that's as important as getting themselves vaccinated. And not only for themselves, but for everybody. You know, now, Dr. Amjad and General Hoyer, if you've got something else to add, that's fine. But I'm telling you, Brendan, I personally believe that we've got more bad days in front of us than good right now. We have got to get through this, and the only way we're going to get through this with an outcome that is halfway good is we've got to get more and more and more people vaccinated. We're not getting enough. We're getting a lot, but we're not getting enough. General, if you or Dr. Amjad have got anything, go ahead.
Governor, I can't add anything to what you just said. You've laid it out plain and simple. It's going to be a challenge going forward. We know in the last surge, and we know nationally, when the numbers go up, we see a lag before we see additional hospitalizations and deaths. And the only way to work our way out of a bad outcome is vaccination. Thank you.
Thank you, Brendan. Governor, I'll turn it back to you to close out.
Well, again, I know it's Labor Day. I want everyone to be able to enjoy Labor Day. I want us to celebrate and appreciate the fact that labor has made this nation strong and has led this nation in many, many ways. But I want you to know just this, that it's Labor Day and your governor is trying with all in him to try to get you to realize that you've got to get yourself vaccinated. We don't have any other tools in the tool chest. There's nothing else we have. Nothing that we've got. You know, we know there's some degree of uncertainty of just how safe a mask makes you or doesn't make you, but it'll probably be somewhat better. But the bottom line of the whole thing is one thing, and that's vaccination. You know, I know without any question, you know, that if we were really to just step back and say, you know, everybody in Putnam County ought to be pushing and helping us get vaccinated. I hope to goodness that they'll do that. I hope they'll do that in every single county of this state. You know, I know that there's a lot of people really frustrated from the standpoint of what in the world's going on. I mean, what are we going to do? You know, should we wear masks? Should we not wear masks? You know, the Board of Education's voting one way. Should we absolutely do this or not do that and everything? And I would tell you, you know, if you believe that your child should have a mask on at school, send them with a mask. You know, and absolutely, we're going to continue to try to do any and everything we can do right here. But just please help me. Help me get us vaccinated. That's the only ticket we got. I wish to goodness that I could tell you something else, but the bottom line is just this: we're going to have a bunch more people die. That's all there is to it. If we absolutely don't kick it in gear and kick it in gear like nobody's business and getting us vaccinated. So thank you a bunch.